So what we are trying to establish is that the glycolytic pathway is a very important pathway for generating energy for red blood cells, right? And we are trying to establish that these pathways along it has several enzymes that help to ensure that this pathway actually came to a completion. Do you understand? So we are trying to establish that if there's any problem with any of the enzymes along this pathway, there's usually how it manifests. Do you understand? All right. So now we are picking out the phosphofructokinase, that's a PFK. So now we are saying that if this is the glycolytic pathway, now if the phosphofructokinase that is supposed to what catalyze the formation of what this fructose is it fructose monophosphate to fructose uh, diphosphate, right? So if the phosphofructokinase is deficient, what will be, okay, how will it even manifest, right? So let's quickly look at that. Um, we said that phosphofructokinase deficiency is a rare genetic disorder affecting the epithelial pathway of glycolysis. It will lead to impaired red blood cell function. Now, here are some key aspects of the deficiency, all right? It is an autosomal recessive inheritance. Autosomal recessive here in the terms that for you to actually have this problem, you must have inherited both genes that are default. Okay, so it is a chronic non-spherocytic hemolytic anemia. Like when you have it, one of the manifestations is your red blood cells, the membranes will not be strong, so they'll just be easily broken down. Do you understand? The severity is variable and it's range from mild to severe hemolysis. Splenectomy may be beneficial. Phosphofructokinase deficiency is the most common enzyme deficiency in the glycolytic pathway, right? The prevalence is about 1 in 100,000 to 1 in 500,000 people, right? So it's not a common disease condition that you see around, all right? Molecular defects include missense mutations, deletions, and frame shift mutations. All right, so they're just simply talking about this process here. The enzyme that actually catalyzes it is not there. So if this enzyme is not there, how will it even manifest, right? So it will lead to things like muscle weakness and cramping. So patients that have this type of problems, these are the possible complaints that they will have in the hospital, right? They'll be saying that they can't do any exercise. That's exercise intolerance. There'll be hemolytic episodes which can be triggered by exercise and stress. There'll be increased risk of what? Developing gallstones, right? So this phosphofructokinase deficiency affects the third step of glycolysis, which is converting the fructose 6 phosphate to fructose 1,6 biphosphate, all right? And this will lead to impaired energy production and the red blood cells will not be functioning as they should.